Dr. Scholz, can you explain how first-generation hormone therapy works for prostate cancer patients? And I know there's a lot of fear involved in taking hormone therapy, so can you discuss the ins and outs of the process?
Well, it's a vast field, and how it works is, of course, these medicines stop the production of testosterone in the testicles, and the cancer cells need testosterone to survive. And so when that testosterone is blocked out, the cancer cells regress and shrivel up and die. Blocking testosterone doesn't eradicate every male characteristic, but it usually causes one's libido to disappear, and it can easily cause the loss of muscle. So it's a big step. There's different things to be done to try and tamp down these side effects and to make it more tolerable. It's, of course, incredibly effective and causes the cancer to shrivel and shrink away rapidly. So there's a great value in it. But it's powerful. It has to be handled with expertise, and if it is, then it's pretty tolerable.
So what are the most common hormone therapies that men would go on, and do you have a preference in either one?
Well, most of them are injectable. We're talking again about the first-generation medicines that stop testosterone production in the testicles. And Lupron is kind of like the Kleenex of these sorts of things, but there's Trelstar, Eligard, Firmagon. They all work equally well, in my opinion. Firmagon doesn't cause any short-term flare like the other medications, but Firmagon hasn't developed a 3-month formulation yet, and sometimes causes rashes. So they're all good, basically, and this is the backbone for two general areas. One is in men that are undergoing radiation who have high-risk disease, to try and enhance their cure rates. And then in men that have had previous surgery or radiation and the cancer is coming back, to control the disease in the relapse setting.
So in the relapse setting, how long do these hormone therapies normally work, and have you seen it work in an extremely long time in some patients?
Yes, there are many different types of prostate cancer. The average duration for hormone effect after a relapse is about 10 years. But I've had men with metastatic disease remain in remission for 20 plus years.
Wow. Mm-hmm. So in those 10-year spans, like with the average man that, from the clinical trials, is that intermittent or is that constant?
Either way. The clinical trials have shown that men can take holidays, so-called intermittent therapy, and stop the treatment for a period of time. Testosterone can recover. PSA will start rising up to 5 or 10 or something like that, and then have their Lupron shots restarted, and they'll work again. And using that approach doesn't cause the cancer to grow more quickly or cause men to develop resistance or die of disease any more quickly than if they remain on the treatment throughout.
Thanks for watching. If you would like more information about any of the topics we discussed today, you can go ahead and visit our website at PCRI.org, and go ahead and subscribe to our YouTube channel. We post new prostate cancer videos every week.